Good afternoon, everybody. Hi, my name is Karen, and today we're going to just do a quick demo on good skincare on the lower limb. So again, I'm going to wash the leg. I'm going to make sure I wash my hands first, and I'm going to sponge down the leg with some sponge or cloth. So I'm going to go with that. This is something that you can do at home. Okay. So you always go downward in the direction of the hairs. Okay. Right down and in between the toes. Okay. And just underneath. Perfect. Okay, and you discard that, and then you pat dry it. This is good for anyone that has had leg ulcers and they're healed and they're suffering from dry skin or varicose eczema or anything like that. Okay, so you pat dry it. Okay, perfect. So again, from that you can use either moisturizers or any type of moisturizers. So we're looking at creams, ointments or lotions. So creams would be, example would be Epiderm cream, Aveeno cream. I tend to use sometimes this double base. It also comes in a blue little bottle as well. We also have ointments, so paraffin ointment is the most popular one, cheap and cheerful. And then we've other type of barrier creams that you may need to use if you have wounds on your legs and that it's oozing onto the good skin. So this is where we use the barrier creams. Again, when you're applying a moisturizer, you make sure that you're using the one for the client themselves. You can use ones that are pumped down. We don't have one here. So I'm just going to demo just on how to put a nice bit of moisturizer on the leg. So we go downward in the direction of the hairs. Okay, right down. Okay, you always go down in the direction of the hairs, the hair follicles, so that they're flat on the skin. Always go under the heel. And I would never put moisturizer in between the toes. Hey. So if anybody's wearing types of compression hosiery or compression stockings on their limb, this is just an example of one. These are all prescribed either by a vascular surgeon, your nurse prescriber in your leg ulcer clinic, or maybe your GP. So again, you always prepare and you always have the compression stocking in your hand. Some of them are open toe or some of them are closed toe. This is closed toe. This comes in a lovely sand colour. You can get them in black for a gentleman. So one example of how to put them on is put your hand in to the stocking and pinch the heel and then turn it inside out. Okay, so I have the heel here. And then I'm going to stand parallel to the client and I'm going to pop the stocking over the toes. And then I'm going to feed it up over the ankle. It's always good to stand parallel to the client because you get more of a grip. And then you go downward and you get out any creases and you make sure that it's on the heel. So in relation to getting the correct measurement for your hosiery, we always tend to measure the largest part of the calf and just above the ankle bone. And you would always do this when somebody is standing and usually in the morning time. Thank you.